Okay. So if you guys aren't quite finished, that's okay. You can keep kind of plugging away at this. But I will talk a little bit more so kind of here, filibuster a little bit at the very beginning. So since this is our last actual class, which makes me a little bit sad. Probably doesn't make you guys sad. I'm a little sad. I'm always a little sad at the end of every semester on these. Remember that Wednesday we will do test review. Okay, so if you want, if you don't, then you don't get to complain about whatever's happening. I should also mention, I assume you guys have gotten an email about doing the course evaluation. You guys gotten that? Okay. If you didn't, if you have classes that aren't in our department, you may have noticed that it's a little bit different. Our department, we are piloting a relatively newer way of doing the course evaluations that not all other departments are. We think the university will move to something more like what you guys are doing for this class, rather than the traditional just, how much did you learn compared to other classes? 1 to 5. How hard was this class? 1 to 5. We find that those kinds of things very often track with if you found your instructor to be sort of friendly and personable, or the class wasn't very difficult, you give them high numbers, and then you don't really think much kind of beyond all that. So what we're doing for this one is it's a little deeper. It's asking you some more in-depth questions, and I know that's going to take a little bit more time on y'all's part to complete, but please do complete it, okay? We read these and we take the things that are said very, very sort of seriously, and value that kind of input that you're giving. If there are things you like, tell me. If there's things you don't like, I know what people don't like. I'm not the world's most organized person. You can say it again and again. I know that's just my personality. I can't change all of that. But we know those kinds of things. We do try to adjust. This lab worked, this lab didn't work. This way of doing this worked, this other way of things didn't. We're always trying new and different things, and we listen, and we want to try to make it better for somebody down. Okay, so please take some time to fill those things out. That would be really appreciated online. Okay. So in our last lecture, I'm going to talk about something that is very near and dear to me. Okay, and it's a thing that I don't think we talk enough about. Just as a group, y'all's generation is much better about this. My generation, less so. My parents' generation, we begged my mom to go to talk to a therapist pretty much every time I see her, and she acts like that's basically akin to drowning puppies or something, in the worst kinds of ways. But that's going to be the idea of mental health. Okay, and so we're going to talk today about anxiety and anxiety disorders. We're going to talk about depression and depressive disorders, and a couple of other kind of mood-related things. And we're going to talk about the role that simply being more physically active, exercising, can potentially play in helping to moderate some feelings of anxiety and some feelings of depression, and the potential benefit of exercise and physical activity in those areas. Okay? And then at the very, very end, we'll do a little bit about how we can monitor mood and kind of feelings of mental health and well-being, and how that may relate and be important for athletes and how they train. And okay. All right. So the first thing we've got to talk about, okay, if I want to know about your mental health, I want to know about something called your psychological state, okay, I have to ask you, okay? So let's do a fun thing. Ramsey, if I ask you if you were feeling anxious today, what are the chances that you would tell me the exact same thing if it was just me and you in my office versus me and you with everybody else in here in class? Would you feel more comfortable if it was just us rather than everybody else?
Yeah, probably.
Probably. Okay. So one of the things we have to keep in mind when you ask people questions about their mental health is, one, it's subjective, and two, it's what we call self-report. Okay, self-report means you tell me, okay? You tell me how you're feeling. I have to trust that you're being truthful, okay? That you're being truthful. And we know that there are some circumstances under which people are not as truthful or truthful at all as they might be in other circumstances. We have to keep that in mind. Okay? The other piece of this is that it's subjective. Okay, so we'll continue with the thing. Ramsey, have you ever felt anxious about anything?
Yes.
Okay. Devin, have you also felt anxious about something at some point in your life? Okay. Haley, have you ever been anxious? Yeah. Okay. So the idea that it's subjective, though, is that how Ramsey feels and the things that make her anxious, she may experience that very different than Kaylee, who may experience it very differently than Devin. Okay. We'll talk about some of the both cognitive and sort of mental and then the somatic or actual physical symptoms that accompany anxiety, especially. Okay. But everybody feels and experiences this differently. Okay. And so that makes it hard. It makes it difficult to fully be sort of sympathetic and empathetic with other people. It makes it difficult to truly kind of understand, well, why are you feeling this way when you're anxious, when I feel this other way? Why doesn't it all look the same? You just got to keep those things in mind. Okay. So some of the things in those questionnaires that we asked you about, it was saying, what are you feeling? Right? What are you feeling right now? What might those things look like? We're going to ask a bunch of questions to try to capture it as best we can. We also need to ask people things about how long do you experience these symptoms? Okay. I could probably do something and make Lauren feel anxious right now for 10 seconds or something. Okay. That's very different, though, than if I say, okay, I'm just kidding you, you don't have to do this, versus I feel this way over a long period of time. Okay. I just in general feel this way, or I have felt this way for a month or 2 months or 6 months or 5 years or my entire life, whatever you want to say. So we need to understand, is what you're feeling transitory or is it permanent? Okay. It's going to be finals week next week. There's a reasonable chance that many of you will feel anxious, or you may feel sad or depressed or angry or something over the course of the next week or so. But there's also a chance that a lot of that may go away once you're through finals week. So we need to understand sort of, what does this mean? It's a real thing if it's transitory, but it may tell us different things about sort of your psychological state and mental health if it's not long lasting. Then we also need to ask you about the intensity, okay? The intensity. So we would do things like, say, McKenna, if you're anxious right now, if 1 is the least amount of anxiousness you can ever imagine, and 10 is the worst, where are you on that scale? You need to know the intensity, because you may be mildly like a 1 or a 2 anxious all the time, but you're only ever a 9 or a 10 in very certain circumstances for short periods. So we need to understand that as well. What's the timing and what's the intensity? And we have to rely on people to be honest when they self-report this. Okay. Okay. So we are going to, for the most part, talk about things that people consider to be moods. Now, I know all of you have had general psych, right? Do they talk about, and I should probably get a syllabus and notes, do they talk about anxiety, depression, they talk about sort of the different kind of mood states, mood disorders and things in general psych?
Oh yeah, that's a big chapter.
It's a big chapter. Okay. So when I talk about a mood means a more sustained feeling. Okay. We can say minutes, but really it is hours to days to week to months. It's a much longer kind of term thing. Okay. You'd be like, Madison's in a mood, right? Everest was closed this morning, it run, it was cold. Okay. That may not mean that she's in a mood. Okay. If she feels that way all day and tomorrow, then potentially we can call it a mood. Emotions, on the other hand, are shorter term. So people oftentimes use these things interchangeably. That's not to say that when you have a mood, you're not feeling an emotion or experiencing that. Okay. It's just that emotions tend to be much shorter term. Somebody cuts you off in traffic and you get mad and you honk your horn at them and you curse at them and you yell for a minute and then you kind of go on with it. That's an emotion. Anger. Okay. It's angry at you. Right now, moving on. So people that have what we sometimes call, I don't like this terminology, but this is what they use, what's called a mood disorder. Okay. Mood disorders are intense negative feelings that are often sustained for weeks or months. I feel anxious. I feel sad. I feel depressed. I feel anger. I feel muddled and confused, whatever it is. Okay. Intense negative feelings. Well, Dr. Black, how intense is intense enough? I don't know. Okay. It's going to vary from person to person. What we normally do, though, when we assess a mood, is we look at two sides of it, and we ask you to give us a rating, either numerically or something along this continuum. Okay? I can say very generally, Riley, are you generally in a pleasant or unpleasant mood? How have you generally been feeling over the last month or something? And you could tell me, okay? Between pleasant and unpleasant, I'm over here, right? It's cold. I don't like the cold. I'm mad at my roommate, whatever. These things are going on here. My classes aren't going as well as I would like. I'm over here. I'm on the unpleasant side. Okay? So we can do very general, just very generally how you feel. Or we can be very, very specific. We could say, okay, are you feeling happy or are you feeling sad and depressed? Where on that? Are you feeling anxious or are you feeling calm? Okay? And so what you guys will note with this is one of the key things is we have to use verbal descriptors. We have to pick out words that we hope mean roughly the same thing to multiple people to describe what it is that you're feeling. Okay? And so that's why when you get these questionnaires, there's all of these questions that are trying to get at roughly the same thing because everybody may approach how they verbalize or how they cognitively evaluate anxiety using slightly different words or descriptors than someone else or depression. Okay, so we can look at those kinds of things. All right. So one of the things that is very often used when we look at moods is what I gave you guys, the profile of mood states. The idea behind the POMS is to quantify intensity of feeling. Okay. And we get to pick a time frame. I think on the one that I gave you guys, say over the last week, is that what it says? Yeah. You can cross out week and say over the past month. You could say, how have you been feeling the past 24 hours? It all tends to track pretty well. Okay. But we are looking at intensity. So am I anxious? I'm extremely anxious. I'm a little bit anxious. Like, where am I going? But you guys will note we had 6 different dimensions. So there are 5 words. There's 5 things on there that are going to try to get at the dimensions of anxiety. Okay. Are you worried? Are you fearful? Okay. Are you not calm? Like, people will try to get at it. We'll ask about, there's 5 questions about depression, but it may be sad, unworthy. Okay. It's going to kind of get some things that way. So we ask multiple things, and we hope by doing that we can capture in as good a sense as possible how people define those things for themselves. Okay. So what I want you guys to look at now is pull up your palm screws. Okay. Here are the 6 dimensions, and I just want you guys to look. Okay. Now, what I've given you will show some normative data later on in the class about how the extent to which exercise can alter these things. But a lot of our data doesn't use the brief form of the palms like I've given you. Okay. So what we're going to look at, though, is that, let's just say, if you guys are over, let's just say, about a score of 12, okay, over a score of 12 out of 20 on any of these dimensions, then you're probably somewhere above the normative average for college-aged individuals. Okay? And so I want you to think about it, right? If you're feeling anxious, if you're feeling angry, if you're feeling fatigued, what's been going on this week that's making you feel that? Okay? What's been going on? So we do this a lot in my lab. If you're going to be in one of our experiments, you fill one of these out. And if you're going to be in a thing where you have to come for testing over a month or 6 weeks, we do one of these like every week. And it's interesting to track. I can pick out when people have tests. Okay? We can pick out if you've had a fight with your roommate or a boyfriend or a girlfriend or something like that. These things track really, really well. And so for some of the things that we measure in my lab, where you are on these matter, but it may actually affect some of your outcomes. Okay? So just kind of keep all of that in mind. Let's talk about what we know about different mood disorders and the ability of physical activity or exercise to have some hopefully positive effect on those things. Okay? So the first one we're going to talk about is the most common type of mood disorder or emotional illness in the world, and that is anxiety. Okay? I have an anxiety disorder. I'll try to be very honest about all that. We'll talk about what mine is in just a minute. Okay? About 20% of adults, develop anxiety disorders or have anxiety disorders that warrant treatment. Okay? Either in the form of some sort of cognitive behavioral therapy, talking to a therapist or a counselor or someone, or taking medications. Okay? As someone who does both, I advocate for both of those things for pretty much everyone. Okay? You may not think about it, but there's a very high healthcare cost to emotional disorders. Almost $50 billion in lost work productivity, in cost of treatment, okay, from both a prescription and seeing actual kind of face-to-face or online counselors now. Okay, things that we know about anxiety disorders. They're 60% more common in women than men. Okay, part of this, we think, ladies, y'all are not more anxious, right? We can make the joke that it's the guys that are making the ladies anxious. If we just act a little better, y'all would be so anxious all the time. The honest thing is probably men are just as anxious. They just don't want to tell anybody. Okay? Again, back to that self-report. There is, and some of this has changed with my generation, and especially more so in y'all's generation. There is this idea of sort of what it means to be man or male or expressing these things, right? I'm strong, I'm silent, I don't talk about my emotions, I don't talk about my feelings or anything else. So they're just like, whatever, I'm fine. Right? I'm worried all the time, but I'm fine. Don't worry. Okay. So I think a lot of this is simply reporting bias. It seems to be, again, more common in Caucasians than in other ethnicities. Probably not true. Again, probably a little bit more sort of cultural acceptance of anxiety disorders or cultural, I guess, norms that it's okay to try to go and get treatment for this anxiety disorder. Okay. One of our health promotion faculty, Dr. Ober-Allen, studies stress and anxiety and things in minority populations, and we'll talk about sort of some of the effects of systemic racism and things on all of this. Anybody felt over the last couple of years just sort of anxious all the time about the pandemic? Kind of felt that way, like I can't go see people, I can't do this, I'm worried. Are we safe here? Should I wear a mask? Should I not? Should I get a vaccine? Should I not? What else is going on? This is creating problems for me with school or my family, with working, all of these other different kinds of things. There's some data that that's what it's like to be, in some ways, to be and live as a minority in this country all the time. Those are the similar kinds of things, right? You're worried about all of these kind of actions. Okay? So a lot of this may not be that as a white person, I'm just inherently more anxious. It's just that there may be some cultural norms that it's more okay for me to admit that and to try to get treatment. A lot of it is also related to socioeconomic status. People with higher socioeconomic status tend to have more anxiety disorders just because they're willing to go and get diagnosed and treated. Just some things to keep in mind. Okay. So what is it? If you have anxiety, How do we define it? So what it really is these feelings of apprehension, worry, and tension. Okay? Anxiety is worry. Okay? It's worry. Phoebe, are you worried about anything right now? You have to share, but are you worried about anything right now? Good. Okay? Are you worried that some bad thing might happen at some point in the future? No. Okay, good. I need to be more like Phoebe. You asked me that question, and I'm like, I'm not worried like right now, but I'm certainly worried about like what's going to happen at Christmas, what's going to happen a year from now, what's happening with my daughter at daycare. I'm worried about, and if I don't have anything to worry about, I'll worry about the fact that I don't have anything to worry about. I'll just invent some worry. Okay. So anxiety is not fear. Okay, it's not fear. Fear often lasts longer, and anxiety lasts longer and does not have an obvious external stimulus. Okay. We could make Kaylee afraid. Kaylee, are you afraid of, I don't know, snakes or spiders or alligators or anything like that along those lines? Not so much? Mildly. Okay. There's probably some, I don't know, clowns, whatever it might be. There'd be something that maybe Kaylee is afraid of, and we put her in the presence of that, and she's afraid. She's anxious. It looks the same way. She's worried about that, but as soon as we take it away, it goes away. Okay? Those are phobias. Those are fears. Those are a type of anxiety disorder, but it's a very separate thing. Okay? You may not think there's an external stimulus, or you may think, well, I'm worried about my test. That's not an external stimulus. Okay? That's an internal thing. Why are you worried? You're worried about how you're going to do, how are you going to study, what are my parents going to think if I don't make a certain grade? If I don't get this grade, am I going to get into PT school or med school or whatever else that I want to be? Those are not really something externally that's going to hurt you. Oftentimes, with anxiety disorders, your feelings of worry are accompanied by what we call somatic symptoms. There are changes in the autonomic nervous system. Okay, you release epinephrine and norepinephrine, and so Riley's heart rate goes up when she's worried about something. Okay, her heart rate variability decreases. Your breathing rate may go up. Okay, you guys ever been in a situation, I don't know, things where people are tending to be a little bit anxious? You're on a first date. You have to get up and talk in front of class, or you have to give someone bad news, pick something like that. You think like, my palms are sweaty. My mouth feels like it's a little bit dry. Okay. I feel like my face is flushed or something. Those are somatic symptoms of being anxious. Those are real things. Okay. One of the things that separates anxiety from certain stuff. Okay. The other piece that we want to talk about is state versus trait anxiety. All right. So everybody pull up your STI scores. Okay. The first 20 questions on that index ask you, how do you feel right now? Okay. How do you feel right now? That is what we call state anxiety. Okay. Is Devin worried now? Okay. Look at those scores. Then look at your scores on the back, the other two, from 21 to 40. That is for what we call trait anxiety. That says, in general, over the past 6 months, how have you felt? Okay. Now, for some of you, those two things may line up. For others of you, it may not be. For me, I'm not particularly anxious today. Okay. My state score would be pretty low. If you look at my trait score, though, it would be very, very high. Others of you may have low trait scores, but may be very anxious because you've got a project this week, or you've got a test, or I don't know, whatever else, some things that are going on. Okay. State is now, trait is in general, long-term kinds of things. We use the trait score to diagnose you with generalized anxiety disorder. Okay. Generalized anxiety disorder. We'll talk about that. Okay, well, rather than a minute, we'll just go now. Okay, so it's okay. On the trait score, which is the thing that we use to diagnose, okay, If you are over probably 43 or 44, then you're above the norm, and there is a chance that you have generalized anxiety disorder. Okay, so it's scored from 20 to 8. If you're over 50, you have an anxiety disorder. Okay, my trait score this morning, my trait score was 71 out of 8. Okay, 71 out of 8. It's a little high for me. It's been a pretty stressful 6 months. It's a little high. I'm usually somewhere in the mid to high 60s. I do this every semester. It's usually where my trait is. Okay. But my state this morning, if I had done it, would probably have been like in the 30s. I'm not particularly worried today. But in general, I worry all the damn time. So look at your scores. Okay. Look at your scores. We imagine the numbers tell us that about 1 in 5 of you, although maybe more because we have a class that is predominantly Caucasian women, okay? So maybe 30% of y'all by epidemiological values, we would think, probably have an anxiety disorder. If you've got a thing that's in the high 40s or 50 or whatever, there's a reasonable chance that you do, okay? And I would encourage you that if you're there to consider maybe want to talk to somebody. Go see if you can go to the counseling center. Talk to somebody. See if they can put you on some meds if that's a thing you'd be interested in. Okay? It's very common. It's a very normal thing. It's a thing that's very, very controllable, and it's not a thing that you have to kind of go through. So when people ask what causes anxiety, like what's going on, we have absolutely no clue. Okay? We have absolutely no idea. Okay? We know that some people are just prone to this. There's some good things from anxiety. It gets you to study for a test. It gets you to not run out in front of traffic. Okay. There is some evolutionary value to having an anxious response or being fearful of certain things. But the disorders are likely due to imbalances of neurotransmitters, okay, dopamine, serotonin, GABA, things of that nature. Okay, a lot of medications for anxiety deal with those things. They deal especially with serotonin. Okay, is there differences in brain processing or cognitive processing? Do you think about things in certain ways that are a little bit different and that lead to this kind of loop of worry and anxiety? Are there environmental things? We know that can be a thing. There's a lot of genetic things. My mom is just as anxious as I am, if not more so, and yet she refuses to ever admit to it. Probably some other stuff. Okay, so it's hard for us to know for sure. Some people have, as you guys will see, have post-traumatic stress disorder and things that is going to occur following some kind of very, very specific thing. There's more than 5, but these are kind of the 5 major forms of anxiety disorder. There's generalized anxiety disorder, which is what I have. I just worry about everything. Okay, I worry about everything. Phobias or fear, kind of unreasonable fears of social situations, of spiders, of snakes, of butterflies. I ever told you guys that I was attacked by an owl when I was a grad student? I was running and I got attacked by an owl at night. And then I kept running and I had to go back by that similar spot to go back to my car. And like a dumbass, I ran by again and I got attacked the second time by the same owl. So
Attacked like how? Like what did it do to you?
I was running along, just doing my thing, and something hit me in the back of the head. I thought a branch had fallen out of a tree because I was running under a tree and it had like hit me and it knocked me over. And I'm on the ground and I turn over and all I see is an owl being like, ah! You know, so I get up and I sprint away and I, soil myself and kind of regroup and run off. I'm sure the people driving by on the road thought I was on LSD or something. Like, what the hell is this crazy guy?
Take that clip from the Zoom out of context and you get the same thing.
Right? Same thing. And then I ran back by to go back to my car on the other side of the road and the thing chased me again. And it chased me for like 100 yards. And so, yeah. So I have maybe not quite a phobia, but I don't like birds. I don't like birds swooping over my head. If we ever go to the beach, the stupid seagulls swoop around, and I do not enjoy that. Okay? I don't like being in the water for fear of things under the water touching me that I can't see. Okay. I had to take a break. We went to, oh gosh, for our 5th wedding anniversary, we went to a place that I think it's owned by SeaWorld in Orlando, but you can swim with a dolphin. It's called Discovery Cove. You can swim with a dolphin. We have pictures, right? So we're out there, and you get to like pet the dolphin and hold the dolphin's dorsal fin, and the dolphin pulls you around a little bit. But associated with all of this for the rest of the day is they have these things where you can go out and there's all these stingrays, right? And you're in a little shallow with the sand, there's all the little stingrays like it's in the Caribbean, and they have a deal where there's these big, like the deeper water stingrays you can swim around. And my wife wants to be a marine biologist. This was literally like 3 weeks after Steve Irwin had been killed by a stingray. And so like I'm out there like snorkeling around. There's all these like 4 foot wide like stingrays. My wife's trying to touch them, and I'm just losing my shit. And I'm like, nope, I'm out. So I had to go sit on the beach the rest of the fake beach the rest of the day. Unless somebody bring me a margarita, I'm not getting in the water anymore. Like physically, like I can't breathe. Like this is too much. Okay. Panic disorders. So phobias, those things. Panic. So anybody ever had a panic attack or something? Okay. Relatively common. Those are a separate kind of thing for those sorts of things. You can have had a panic attack and not necessarily have a panic disorder. You can have 1 or 2 here and there, and it's not that big of a deal. I actually have some medication that I, on rare occasions, will have panic attacks. My doctor gives me, like, for the year, I get 6 Xanax. That's all that I get for the entire year. So if I'm having a really, really kind of crazy day, sometimes I will take one of those. But that's those kinds. OCD, or obsessive compulsive, is a form of anxiety disorder. And this is like for real, not just like I want all of my notes to be in the same color and lined up over here. Or my wife revealed to me this weekend that she has for 15 years of us putting out Christmas lights, not like the fact that we're mixing bulbs that are of different sizes, and she doesn't think that they match. And she just told us this weekend. My dad and I were like, what the hell? Like, where's this been? That's not exactly obsessive compulsive. This is, you guys can find videos on these things. You may know someone that is this way, but people have this, a lot of it involves like touch and feel. You know, like I have to wash my hands over and over and over and over again until it feels just right in a certain way. Or I'm only going to use like that bar of soap like 1 time, and then I got to get a new one. I'm only going to turn the lights on and off a certain number of times until it looks and feels just right before I'll leave a room or something. Okay. And so this can be these kinds of things. The obsessive part means you think about these things all the time. You obsess over it. The compulsive side is that I engage in either the thinking or the actual physical behavior without an ability to sort of have the power to stop it in some ways. I'm going to think about washing my hands over and over and over again, and I'm going to do it over and over again. Even though I know that I should stop, it's really, really difficult to stop. And then PTSD is also a form of anxiety disorder. And there are some things that are associated with PTSD. There's a thing called Gulf War syndrome that we've seen a lot of. It was first sort of diagnosed, or kind of, I want to say noticed, but they kind of began to understand that it was a little bit of a different thing after the first Iraq War in the early 90s, but we see it now in veterans a lot. We sometimes will see it in post-traumatic stress in people that have been sort of held hostage or taken captive and kidnapped or had some other sort of really traumatic kind of thing. But this is also, we think, a form of anxiety. Okay. So how do we diagnose you with having an anxiety disorder? These are things that I've taken from something called the DSM, which I forget what the S stands for, but it's the diagnostic, I think it's a diagnostic symptom manual, but it's the thing that clinical psychologists use to diagnose you. My wife's college roommate is a clinical psychologist, so she helps me out with all of these things. So what we have to see, okay, to have a diagnosis of generalized anxiety disorder, you have to have unrealistic or excessive worry about 2 or more life events or circumstances for the previous 6 months. Okay? 2 or more for at least 6 months. Difficulty controlling and coping with anxiety and worry. what difficulty looks like is going to vary. Okay. It could mean that you think about things too much. It could mean that you avoid certain places or behaviors or people. It could be that you're an excessive planner, and it's just gonna, that's a thing that's kind of left up to some gray area. The source of your work is not due to panic, social phobia, obsession compulsion, or weight gain. Okay? So there is some thought that maybe anorexia and bulimia may also be forms of anxiety disorders that are often paired with depression. Okay, and then the presence on most days of the following symptoms. I feel tense, wound up, or restless. I am easily fatigued. I have trouble concentrating, which has only been made worse by our phones and social media. I am irritable. You have tension in your muscles, especially people see it like in your jaw and things like you're grinding your teeth and you're there. Or if you're ever like, I'm thinking about this and I don't know, and you kind of look down and you're like, I've been flexing my fingers, or just kind of feel tense. Okay. And difficulty sleeping. Man, the sleeping is a big deal for me. Right? I have a hard time sleeping, getting to sleep, and then I wake up and I have a hard time going back to sleep. It's not particularly good. Okay. So this is the things, the kind of cluster of things that we want to see in order to say that you probably have generalized anxiety. Okay. And people that have most of these things, if you see what some of these words are they're going to match up with some of the stuff on the State Trait Anxiety Index. That's how we do some of our diagnostics. So I told you guys that there are thought dimensions and physical dimensions of anxiety. We call those cognitive. These are things that are mostly covered on the State Trait Index. And then somatic symptoms, which there is a thing called the body awareness scale, which I always chuckle at when I hear. But cognitively, it's like, do you feel calm? Do you feel tense? Are you nervous? Are you relaxed? I'm presently worrying over possible misfortunes. That's mine. I'm always worrying about possible misfortunes, things that we have no idea of knowing one way or the other. Okay. But then on the body awareness, like your heart is pounding, your mouth is dry, my hands are shaky, right? My vision is blurred. I feel cold. Okay? I feel cold. Not because it's cold out like today, but just sort of in general. You guys know the saying, you got cold feet? When might someone get cold feet, McKenna? You were not in your head.
Like when they don't know the
Okay. Okay.
or they're like trying to decide and
I
they
don't want to do
Yeah.
this. I was going to do this, and then I decided not to, right? So you guys aware of the show called Mythbusters? I know what Mythbusters is. It used to be on Discovery Channel. They did a thing where they looked to see if when people got very anxious, if they actually got cold feet. You know what they do? As it turns out, they do get cold feet. Because the blood flow from the autonomic nervous system doesn't go to the skin. It does not go to your feet. But of course, they had to like put people like, what are you the most scared of? And they put somebody like in a thing with a bunch of spiders on it. And they put a thermometer deal, like an infrared thermometer thing on their feet, and you can watch it. Somebody else had to get the thing with like sharks, and it was real crazy. But that was kind of what the show was. But you can get cold feet. That's where some of that comes from. Okay? So, and everybody may experience these things to a little bit of a different extent and things. Okay, so let's talk a little bit about what do we know about physical activity or exercise and anxiety. Some things we've got to make sure we understand before we get into kind of interpreting the results is, are we dealing with state anxiety or trait anxiety? Okay. Do the people that we're having do the exercise and physical activity, do they have an anxiety disorder? Okay. If you're not anxious and you do not have an anxiety disorder, it's going to be difficult for exercise to make you less anxious because you're already not anxious, right? That's going to matter, sorry. When we assess how anxious you are matters, you all will see that weirdly during a bout of exercise, people feel anxious, okay? Primarily because heart rate goes up, breathing rate goes up, body temperature goes up. Some of these somatic symptoms of anxiety are going to go up, and that may get accompanied with some of those things. Okay. And then how many times? Well, I'm measuring before, during, after, kind of what all of these things we have to consider. Okay. So here are some data, okay? And don't worry about kind of exactly what all is going on here. But these were, they had some people fill out the state trait index, okay? And this is looking at state anxiety. So how do you feel right now on a normal day? Okay, we have this is the same person on a normal day. We're going to have them come in. They're going to do a lot of exercise. So here they are. This was when we screened them. This is right before they're going to exercise. This is during, and then this is out to 3 hours post-exercise. Okay? And what you will note is that you get a little bit anxious before we have to exercise. You're in the lab. You don't know what you're going to do, right? I can tell Emma, you're about to have to run. What's going to happen? And she's like, ooh, I'm maybe a little bit more anxious than I was before. It goes up. During, it goes up, and then it comes back down afterwards. And these people were not particularly anxious, and so it did not go down very much afterwards. This just shows a little bit of this. During, it tends to go up. If these people were anxious, if they have trait or they have heightened state, what we tend to see with exercise is aerobic exercise reduces feelings of anxiety immediately after. Okay? Immediately after, you feel less anxious. Resistance exercise also does this, but it's delayed a couple of hours, and we don't understand why. Okay? One of my good friends, that's what he studies is exercise and anxiety, and he does a bunch of resistance training stuff with it, and they don't really understand. Okay? But who does this work for? Everyone. Okay? Doesn't matter how old you are, doesn't matter if you're a man or a woman, doesn't matter if you are exercising in this way for the first time or if you exercise all the time. Okay? If you are low or high kind of trait anxious, if you have state anxiety and you go exercise, it's going to go down, or it should go down in most people. Right? If you want to feel less anxious about your tests next week, go exercise. Okay? Go exercise. That's going to be one of the big key things. Okay? And so you can envision a scenario whereby if I exercise all the time or several days a week, then I may always be in a place, much like with insulin sensitivity from being diabetic, that I'm always in that window after exercise where I'm going to have a little bit of a decreased sense. So here's some very old data, probably as old or older than all of you here in the room. But this is from the Hamilton Anxiety Scale, so it's not the STAI, but it's a similar kind of thing. And what you can see is in these black squares, these are people that are doing 10 weeks of aerobic exercise training, normal stuff, right? 3 times a week, 60% of VO2 max, 30 minutes to 40 minutes a day. You've got the closed circles with the dotted line. This is a medication called clomipramine, which is often given for anxiety. It's a selective serotonin reuptake inhibitor. And then we have this placebo group, okay, who they thought they were getting clomipramine, but in fact, they were just getting the sugar pill. Okay? So what you guys will note, the big takeaway is that the exercise was just as effective as the medication at reducing anxiety. And I love this graph because it so clearly shows what happens with a placebo. Okay? Lana is anxious. I give her a sugar pill and I tell her that it is medication for her anxiety. For about a month or so, it works and she feels less anxious. Okay? That's called a placebo effect. There's nothing in there that's going to cause her to like alter brain chemistry or anything else. But because you think it's going to do something, it actually does something. And that decrease is real and meaningful. But over time, the placebo effect tends to wear off. Okay? So this has been repeated several hundred times in different populations, compared to different drugs, comparing a whole host of different kinds of exercise protocols. The general take-home rule is that If you're anxious, exercise and you will feel less anxious. Right? You will feel less anxious. It may not fully ameliorate all of your trait anxiety, but it can certainly acutely knock your state back to where it's much easier to try to manage it. Okay. How does it do this? We don't know. Okay, we really don't have any idea. We just know that it works. Okay, it's probably a combination of multiple things. People have speculated about the release of endogenous opioids, these things called endorphins, but we can give you drugs. They give just the same drugs they give people to try to get them off of taking Oxycontin or something when they go to rehab. We can give you drugs, we can block the effect of the endogenous opioids, and we still see it most of the time. It may be that the exercise alters serotonin, dopamine, norepinephrine, which we know that it does to some extent. There's some evidence that just raising your core body temperature actually lowers your anxiety. So go take a hot shower or a hot bath, go get in the hot tub, go get in the sauna, okay? It may just be this thermogenesis that's associated with the exercise that does some things. A lot of it may come from distraction. I'm exercising, I have to focus on exercising and the fact that I'm about to die right now. And so I can't worry or think about whatever it was that's going on in class next week. Or it may be their sense of social interaction or a sense of achievement, okay? A sense of social interaction. Especially with group exercise classes, or you feel like I did something good today, right? I did something good today. Likely some combination of all of these different things that may vary from person to person and from situation to situation. Okay? But these are all things that may work. Okay. So let's pause here before we talk about depression. Okay, and take a little break. We'll do 11:35 by our clocks. Okay. And okay. So we're going to shift now from anxiety to talking about depression. And so depression is probably the second kind of most common and in some ways maybe even the most well-known form of mental health issue. And so we define depression as prolonged, although not nearly, it doesn't have to be nearly as prolonged as anxiety, prolonged, intense, and overwhelming feelings of sadness and loss of pleasure in normal activities or things that you normally like to do. Okay, so now the scary part to me. Okay, 1 in 3 people will be depressed at some point in their lives. Okay, what that tells me is we have about 26 people in class, so probably 8 of you guys will be depressed at some point in your life. Okay, of those 8 of you, only maybe 2 or 3 will actually seek treatment for your depression. And of those people that seek treatment, only 1 of those 3 will actually have some sort of effective treatment for depression. So we're not very good, 1, at getting treatment, and then we're not very good at doing actual treatment for this. We're getting better, and then we're making people more aware. Okay, so somewhere between 5 and 10% of people, we can argue, have depression or have major depressive disorder at any one given time. Again, economic cost of somewhere between around $40 billion. A lot of this from lost work productivity, people not being able to get out of bed, to be able to do normal activities and the like. Okay. So the thing with depression, okay, the thing with depression that makes it in some ways more tragic than anxiety disorder is that depression tends to be the one that's associated with suicide. We'll talk a little bit more when we see some of the symptoms of things along this, is that this is the one where people feel like things are so bad and so terrible and that the world would just be a better place if someone was without them, and we have to take care of them back for at least attention. And that's what we have to be concerned about. So from the DSM, here's the diagnostic criteria for major depressive disorder. You have to have 1 of the first 2 symptoms. and at least 5 of the remaining symptoms almost every day, but only for 2 weeks, not for 6 months, just 2 weeks. So think about this if you've ever been in this particular place. Okay, a sad mood most of the day, nearly every day for 2 weeks, or loss of interest or pleasure in previously enjoyed activities, whatever that might be. Okay, going for a run, reading books, playing video games, talking to your friends, whatever it is. Okay, anything that you used to enjoy doing that now you do not. So 1 of these 2, and then 5 of these 7. Okay, significant change in appetite or body weight. That could be up or it could be down, either way. Okay, I'm not hungry or I'm hungry all the time. I'm gaining weight or I'm losing weight. So either direction. Some sort of abnormality with your sleep. Insomnia, so I can't sleep, or hypersomnia, where I sleep all the time. Okay? So some appetite dysregulation, sleeping dysregulation. I am very lethargic, or kind of slow, or I'm super agitated. Okay. One of the other big ones is this feeling of fatigue or loss of energy. I just can't get out of bed. I just want to lay here. Okay. Difficulty thinking or concentrating. And then the 2 big ones that are going to kind of go together, feelings of worthlessness or excessive guilt. You feel like you're an unworthy person. Okay. No one likes you. You're not good for anybody. You're not good for anything. You have no value. Okay. You feel worthless. And then that is often accompanied by recurrent thoughts of death or suicide. Okay. Recurrent thoughts of death or suicide. My guess is almost all of you have been very close to having some of these things for probably a pretty close amount of time to be considered having little depressive periods in your life. Okay? The thing about depression, if you've had major depressive disorder once, you're likely to have it again, but sometimes you go through periods. I'm depressed now for a month, and then I'm a little better. Okay, I'm a lot better. And then it may return. It's not necessarily like you're just sort of depressed all the time for years and years and years, whereas anxiety disorders tend to be a little more kind of focused all the time. But just think you may have been in this situation. Okay, and we'll talk about some of the things that may have led to that in the next slide. Okay, who gets depressed? Well, there does seem to be some genetic predisposition to this. Okay, it does tend to run in families. The extent to which that may be a learned behavior, right? Versus actual genetic thing we don't fully understand, but we think there's some genetics to it. People that have experienced a recent loss or a major stressful life event very often get depressed. Okay? What's a major life event? I don't know. It depends upon what you've seen and done in your life. For a lot of you, coming to college is a major life event. Okay? If you've had the death of a close friend or a family member, something that you cared about, that's a major life event. Okay, losing a particular relationship. Okay, lacking a close relationship, losing a close relationship, a friend, a parent, okay, a significant other. It doesn't just have to be a romantic relationship. We see lots of depression in older adults. Okay? It's very common in older adults because they have a partner that has passed away, or they've had to go to assisted living or something, and that is a loss of their independence, a loss of their house, a stressful life event, all of these kinds of things that tend to occur together. I am here and I can't see my spouse every day. I'm here and I can't see my friends, or I can't do things that I want to do. These are all things that are going to play a role in depression. We do tend to see more depression in women than in men. Again, a lot of that may be simply due to reporting bias. And we tend to see a lot in 35 to 45-year-old women. Okay? We also tend to see it a lot postpartum. And there's a thing called postpartum depression that roughly a third or so of women experience after giving birth. Very common, very, very normal. one of my wife's very best friends. Interestingly enough, her husband is a professor of psychology. She's a biology professor. They both live in Savannah, Georgia, teach at Georgia Southern. But when she had her daughter, she had really, really severe postpartum depression for about 3 months afterwards. It's stressful enough to be a first-time parent, probably an anytime parent from the get-go, much less you're here and I have this baby and I don't like this baby and I don't like anyone else. And I feel you just don't feel like yourself and all of these things. I'm sad and all of this. It happens postpartum because your hormonal balance shifts dramatically right like that. Okay? You give birth and then boom, the hormones all change and things are all haywire emotionally where they can be for a period of time. It's not talked about enough. We went to all of these. Like, here's how you get through taking care of your baby, or here's how we deal with childbirth, and all of these things. They'll never talk about postpartum. They'll never talk about postpartum. It's a big deal. And other things that contribute to this in some ways, especially in people that are y'all's age, okay, can be moving away from friends and family when you go to college or you go to grad school or you go to get a job. It can also be, and nobody talks about this in a lot of ways, and maybe it's a thing in y'all's world, but it's also a thing in folks that get to be a little bit older. I had a grad student that lost a pregnancy, right? Kind of ectopic pregnancy. She has, in some ways, never recovered from all of that. It's just like 5 years ago. Right? And so you are going to have, again, like a third of pregnancies in, right, with miscarriages. Those can be losses, stressful life events. There's a lot of stuff that goes into all of this that everybody needs to be aware of, right? Ladies, you all experience this. Guys, if you're going to have a partner or a spouse, or just be sort of a support person in the midst of this, you need to understand how all of this goes. You say, why are you sad? Stop being sad. You can't just stop being sad in that way. It doesn't always work just like that. You need to understand and appreciate what all of these things are and how to be helpful. Okay? Of all of the kind of mental health things, depression is the one that's been the most widely studied with physical activity and exercise. Okay? There's been about 1,200 studies on this over the last 40 years or so. There have been cross-sectional studies, there's been prospective studies, there have been studies where we do a single bout of exercise, where we do exercise training. We've been looking at exercise versus other types of treatment. You name it, we've tried it. And just like anxiety, okay, the thing that happens is exercise seems to be very effective or reasonably effective at treating feelings and senses of depression. Okay? Treating feelings of depression. People that are more active in general have a lower incidence of becoming depressed. If you become depressed and you start exercising, or you exercise or are active a little bit more, then that oftentimes leads to decreases in symptoms. Okay? So there's all kinds of things that we're going to see. It seems to work in men and in women, older people, and in younger people. We see it a lot in older adults who remain active or take up activity later on in life. Okay? They tend to have less depressive symptoms. One of the best kinds of exercise or physical activity for depression is group exercise. Do things with other people. You get some social interaction out of it. You get a sense of we're all in this together. Okay, someone to share these things with, a sense of accomplishment, all that. That seems to work really, really well. Not that other kinds don't work, but this, especially in older adults, they like that sense of community and being together. Okay? I suppose that's my thing for take spin class next semester. Or go do that crazy F45 stuff that I see them doing. Have I ever done that over there? It looks hard. Is it hard? And it looks really, really tough.
Yeah, when I first started doing it, there's no like gradual build-up.
You just go. Because I was in there, they were doing it when they lasted. I was in there for like an hour and 50 minutes. And I swear the class like lasted. They were going like the whole time I was in there. It was just rounds and rounds of like squats and push-ups and, you know, rows and other ridiculous things. So, okay. But they're all in there together. Everybody suffers together. So maybe that's a useful thing. Okay. If you're not depressed, you're not going to feel even less depressed than you already are. We call this a floor effect. Okay. So if you're not really having feelings of sadness and worthlessness and those kinds of things, which is good, exercising isn't going to make you necessarily any more kind of happy or anything like that. Okay. But if you do have elevated scores, it does tend to reduce them. And just like with anxiety, it tends to be about a similar magnitude of what we see with a lot of medications. Okay. People that have anxiety and depression that take medications oftentimes have to try multiple medications and multiple doses of medications before they find kind of the right dosing and medication regime that's going to be the best for that individual person. Okay, so I think this is a pretty interesting one that I've recreated here. They had folks where they gave them medication, they had a group where they exercised them, and then they had a group that got medication and exercise, and there did not seem to be any kind of an additive effect of the two, right? So you're not necessarily better off taking the medicine and exercising. You're going to get a relatively similar reduction from both if it's working, okay, in those kinds of ways. But the one that I find to be some of the most interesting stuff is this paper. And I apologize, I don't have the citation on here. I need to look it up again. But these were groups of people that were depressed. They had them exercise. They had another group that got medication, and they had a group that got the combination of those things. And they came back like a year later, and they looked at these people, and they were continuing to exercise, continuing to do medication, or continuing to do the combination of these things. And what they found was, of the people in the exercise group, almost 90% of them reported no relapse of their depressive symptoms, okay, over the course of that year. Whereas the folks that had the medication were at about 60%, and then this gray bar is going to be the relapse, but about 35 or so percent of them had a relapse. And in the combination group, it looked roughly the same. This is the thing that's very promising to me, is that oftentimes, if you've been depressed once, you're going to probably be depressed again. Okay. And so what we can see from this is if people, the more you can stay active, then there's a reduced chance that you're likely going to have a relapse of some of these symptoms. So I think that's a really kind of promising way to look at these things. Okay. Very, very similar to anxiety. How might exercise reduce depression? We don't really know. It's hard to study things that go on in the brain. It's hard to study how it regulates neurotransmitters and cognitive processing, but it may change cognition. It may change self-esteem, right? People feel better about themselves. I'm exercising. I did this today. I know this is good for me. So I feel better about myself, right? It may change your self-esteem. I can accomplish things. A lot of this has nothing to do with appearance, okay? Nothing to do with, I'm exercising, so I feel like my appearance is more pleasing to myself or to others. There may be some changes in norepinephrine. 5-HT that's serotonin, norepinephrine or serotonin. There may be things along the HPA axis that we're re-regulating. We don't really know. There's also this idea of things that are called circadian rhythms. You guys talk about circadian rhythms in physiology at all? Kind of normal daily fluctuations that happen in hormones and neurotransmitters that are control a lot of your sleep and wake cycles. Okay. Exercise helps to regulate circadian rhythms. Okay. It helps to make them more regular. Exercising generally leads to better sleeping. Anybody been struggling the last few weeks since we did the time change? It gets dark at 5:30 now. Okay. So a little more down, a little bit off, having some trouble sleeping. Your circadian rhythms are messed up. Okay. Getting sunlight is good for the circadian rhythms. It's good for sleeping. It's good for your mood. Okay. I think I've mentioned this before, but in Countries that are at high, what are those? Latitudes? Latitudes, the horizontal ones. Nordic countries, let's just say. Okay. You live in the northern part of Sweden or Norway or Finland. It's dark 6 months of the year. Okay. These places have objectively measured the highest quality of life and satisfaction anywhere in the world. They have the lowest rates of poverty. They have the highest rates of physical activity. They have the best healthcare outcomes, all of these things. These people are generally happy and doing well. And yet they consistently have the highest suicide rates in places in the world. Dark for 6 months. Circadian rhythms get messed up. That dysregulation seems to play some role in depression, okay, which then can lead to suicide. So exercising can help with circadian rhythm regulation. So if you've been having trouble with the time change, which I really do now, I didn't when I was younger, but I really do now, try getting a little more exercise kind of right as it's getting dark. See if that helps. Try to get some more sun earlier in the day. Okay. Questions about any of that? Okay. So the last few slides, we're going to cover some things. We're going to start talking about the effects of physical activity and using mood and monitoring mood to look at exercise performance and training, which I can tell you are things that we do here at OU in the athletic department. The Thunder do it. Lots of professional sports teams do this now. It's not really cutting edge anymore, but there's fascinating stuff. Okay. So these are some data where they had female Marine recruits over the course of basic training. You guys can probably imagine what Marine basic training is like, okay? Probably involves getting yelled at a lot, having to do lots of physical and mental tasks. So they've got all 6 dimensions of the palms over the course of this 12-week basic training program. What I want you guys to note is that look at in our negative dimensions, which is everything that's bigger, they've got these really high elevated scores in the first week, and they get better over the course of the 12-week program, and then their vigor goes up. So they feel less fatigue after 12 weeks, even though they're being worked physically and mentally at a very, very high rate. Their depression rates go down, their anxiety goes down, their confusion goes down, their anger goes down in a lot of ways. That has to just be from like learning hand-to-hand combat and getting like shoot guns and things and targets, I think, in a lot of ways. And their energy levels go up. Okay. So what you see with this, okay, this mimics and looks like what athletes look like. Okay. People that are very active have low scores on the negative palms, lower than normal. Higher levels of vigor. This becomes really important. I'll try to show you guys this in the next slide. Okay. What we tend to see is that exercise training makes vigor and energy go up and fatigue go down. It also makes anxiety, depression, anger, and confusion go down. And this observation, when you graph it on the old way we had to score the palms, led to something called the iceberg profile. Okay? Iceberg profile. So here's some data. In the old form of the palms, it was like 100 questions rather than 30. It was published in 1977. Okay? And this one is scored that the normative values for people is at 50 out of 100. So this red line here. What you see, this is what they call the iceberg profile. You've got tension, depression, anger, fatigue, vigor, fatigue, and confusion. Okay? And these are all athletes at the University of Wisconsin. This concept was developed by a guy who was one of the original, he was called an exercise psychologist. His name was Bill Morgan. And a very, very famous, he was a psychologist, but they studied exercise and athletes and these kinds of things. They've got cross-country runners and they're track runners. They've got wrestlers, and then they call them oarsmen. They're rowers. Okay, they're rowers. And so you see the same profile in all of them. And they also have data on swimmers and other kinds of athletes as well. But it's called the iceberg profile because if you think of the normative value as the water line, the vigor is popped out over the water, like the tip of the iceberg, and all of your negative emotions are at or below the normative values. Okay? So, what I would be interested in is if we look, we have several athletes in class. I would be interested to look to see if you guys follow this exact trend or not. Okay, but this is what we expect. Now, here's where this gets to be interesting and useful. If this is what people should look like if you're very active, okay? If we take, let's just say, we're going to take Devin, we're going to take Emma. We've got both of them, and they have profiles that look like this. And I'm going to make both of them go and do 3-a-day F45 classes. Let's just say. I don't know. Right? Devin's like, oh my God, that sounds terrible, right? I don't know what you guys are normally in shape for, but you look like this, and we're going to do 3 times as much as what you're normally used to doing. We're really going to do that. We're really going to push you guys for several weeks in that way. What happens is this thing flips over, okay? Vigor falls, depression and fatigue especially go up, okay? In people that are overreaching, they're doing more training than they're normally accustomed to. If they do that for a week or a little bit longer, you begin to see this thing flip around. Okay? As it begins to flip around, that tends to correlate with declines in physical performance, loss of strength, declines in running time or cycling time or rowing time or performance on certain skills if you're a gymnast or something like that. Okay? So what people do now is we measure this and we get a baseline. Then we start having you do more when we're training you, and we watch this. You come in today, okay? Emma tells us, I'm feeling pretty good. I look like this today. Emma gets the full workout. Devin comes in, her vigor's down, her fatigue is up, and we say, okay, she's this way. We're gonna dial it back for Devin a little bit. She's not gonna have to do, she's gonna do 1 class rather than 3. And then she comes in tomorrow, and she looks back like she's supposed to, like what we would expect. When she looks this way, then she gets 3 tomorrow. Okay? And so we can use this as a tool to monitor whether or not you are fully recovered and you are ready to engage in high intensity, high volume exercise today. Okay? There are some papers that were published in the 90s where a couple of European countries trained their rowers using this exact thing. And they sort of trained one group of rowers doing this, another group of rowers just doing the traditional way of things. And the ones that monitored doing this ended up doing better at the Olympics. This is a thing that is very commonly done. Okay? I know the Thunder do a thing that are like this. The problem is the athletes begin to figure out that if they tell you that they feel crappy today, they don't have to work as hard. Right? But you have to be careful. But sleep affects these things, or the other way around, as you begin to get overreach and these things flip, and your sleep suffers. And so it's just another tool that we may have to try to figure out how people are doing, how are they feeling physically and emotionally. There's a link in this of all of this. And you can use this then to decide, this is today a hard day, this is today an easy day, does today need to be a rest day, et cetera, et cetera. Okay. There's your 10 minutes of exercise psychology. At other places, they have a whole class on this. Like where I went at Georgia, we had a whole class on exercise. There's 3 classes. We had a whole class on exercise psychology, and as well as other kind of capacity. Okay, so